Welcome to the deep dive. Today we're digging into something really critical for burn patients, how doctors figure out the extent of lung damage from smoke inhalation.
Yeah, it's a major challenge. And these inhalation injuries, they really worsen the outlook. We're talking potentially a 20% higher risk of mortality. It's serious stuff.
Definitely serious. And it's not just the initial injury, right?
Not at all. You get complications like pneumonia setting in afterwards,
Mm.
and sadly, the mortality rates can then shoot up towards 60%.
Mm.
So yeah, we desperately need better ways to assess and manage this.
Okay. So the current standard, the abbreviated injury score, or AIS.
Right, the AIS scale, 0 to 4. 0 means no injury, 4 is, well, the worst.
But the problem is it's pretty subjective, isn't it? It relies a lot on just looking at images from a bronchoscopy.
Exactly. It's down to the clinician's interpretation of what they see in the airways. A gut feeling almost.
And studies have actually shown, maybe surprisingly, that this AIS score doesn't correlate all that well with, real-world outcomes.
That's the core issue. Things like how long someone actually needs a ventilator, or even their chances of survival, the link is weaker than you'd hope.
Which is a problem, because that assessment guides the treatment plan.
Precisely. If your assessment isn't accurately reflecting the severity, how do you tailor the treatment effectively? You're sort of flying blind.
And the bronchoscopy itself, the camera scope, it has limits, too.
It does. Seeing damage deep down in the smaller airways can be tough. Plus, image quality varies, interpretation varies. It adds layers of uncertainty.
So we need something more objective, less reliant on individual interpretation.
Which brings us to this new research. It's looking at using deep learning AI essentially to analyze those same bronchoscopy images.
Okay, AI looking at the images, but aiming for a different kind of grading system.
Yes, a more objective one. And the key idea is to base the severity grade on something really tangible, the duration of mechanical ventilation.
How long the patient actually needs the breathing machine.
Exactly. Moving away from subjective visual scores towards a data-driven outcome.
That makes intuitive sense. The longer your lungs need support to get oxygen in and CO2 out, the more significant the injury likely is.
It's a strong indicator of the underlying lung function and the recovery path.
So how does the AI, the deep learning, fit in? You mentioned CNNs.
Right, convolutional neural networks. Think of them as AI systems that are especially good at processing visual information, at spotting patterns in images.
Like teaching a computer to see the important features in these bronchoscopy pictures.
Precisely. The goal is to train these CNNs to look at an image and predict how long that patient will likely need ventilation based on patterns it learns from past cases.
Okay, but AI needs data, lots of data. And medical images.
Yeah.
They're often hard to come by in large quantities, right? Privacy, rarity.
That's a huge bottleneck in medical AI, scarce data. And this study tackles that specific problem very cleverly using data augmentation.
Data augmentation, basically creating more training material from what you already have.
Yeah, like taking an image, maybe rotating it slightly, zooming in, flipping it, creating variations so the AI learns the core features aren't just tied to one specific view.
Simple transformations, but they went further here, using GANs.
They did. Generative adversarial networks. These are, well, quite sophisticated AI models where two networks kind of compete. One generates fake images, the other tries to spot the fakes.
And over time, the generator gets really good at making realistic fakes.
Exactly. Good enough to fool the detector, and hopefully good enough to look like real medical images. They use a specific type called StarGAN.
StarGAN, and they actually modified it, calling it enhanced StarGAN. What was the enhancement?
Good question. They integrated two additional mathematical concepts, or losses, into the StarGAN framework. One was patch loss.
Patch loss. Okay, what does that help with?
It helps ensure that the small-scale details, the local textures within the generated images, look realistic and consistent with the real bronchoscopy images. Think fine details.
Got it. And the other one? SSIM loss.
Structural similarity index loss. That one's more about the big picture. It focuses on preserving the overall structure, like the shape and boundaries of the airways, making sure the anatomy looks right.
So patch loss for the fine texture, SSIM loss for the overall structure. Makes sense you need both for realism.
Absolutely. You want images that are accurate both locally and globally.
And they compared this enhanced StarGAN to other methods, ScycleGAN and CAT.
Yes, standard practice to benchmark against other established techniques. ScycleGAN and CAT are also image-to-image translation models.
How did they handle those? Because StarGAN can handle multiple injury grades at once, right? But ScycleGAN and CT usually work best with just two categories.
Right, so for ScycleGAN and CAT, they used what's called a one versus all strategy. They basically trained separate models for each injury grade.
Ah, so one model learned grade 1 versus everything else, another learned grade 2 versus everything else, and so on.
Exactly. A clever way to adapt those methods.
And before any of this fancy Jan stuff, they did the basic image tweaks too. The rotations, scaling.
Yep. Standard procedure. Things like scaling the image size, specifically between 1.1 and 1.5 times, and rotating by 90, 180, or 270 degrees, just to get more basic variations first.
So all this augmentation, what did it actually do to their dataset size?
It was dramatic. They started with only 146 original images. The enhanced StarGAN process blew that up to 4,119 images.
Wow, that's a huge increase. And it helped with balancing the data too, right? Because you probably start with fewer examples of the most severe injuries.
Precisely. The original data was quite imbalanced across the 6 severity grades they defined based on ventilation days. The ratio was about 3.8 to 1 between the most and least common grades. After augmentation, it was much closer to balanced, around 1.1 to 1.
That's crucial for training an AI that works well across all levels of severity. And crucially, did doctors look at these generated images? Did they look real?
They did, and that's a really important validation step. Burn surgeons reviewed the synthetic images from enhanced StarGAN and confirmed they looked realistic and clinically plausible.
What kinds of things did they notice?
They mentioned specifically that the bronchial structures, the airway shapes, were well preserved. Also, the color distribution looked right, and even things like secretions or mucus in the images for different grades like grade 1 and 3 looked believable. They felt the generated images captured the right features.
Okay, so the data's bigger, more balanced, and looks realistic. The big question then, did using this enhanced data set actually improve the AI's ability to classify the injury severity based on ventilation time?
Yes, significantly. They used a powerful modern classification model called the Swin transformer, and they used transfer learning.
Transfer learning, that's like giving the AI a head start using knowledge it gained from training on other non-medical images first.
Exactly. Leveraging pre-existing knowledge from a huge data set called ImageNet. It helps the model learn faster and better on the smaller medical data set.
And the results, how much better was it?
The accuracy jumped noticeably. Using just the original 146 images, the Swin transformer got about 66.67% accuracy. With the data augmented by enhanced StarGAN, that went up to 77.78%.
That's, what, an 11% absolute improvement? That sounds pretty substantial.
It is. And it was better than the other augmentation methods, too. Baseline StarGAN and CycleGAN got around 69%. CUT was a bit better at 72%. But the enhanced StarGAN clearly led the pack.
And it wasn't just accuracy, right? Other metrics improved too, like precision and sensitivity.
Right. Higher precision means fewer false positives, less chance of overestimating the severity. Higher sensitivity means fewer false negatives, less chance of missing a severe injury. Both improved with enhanced StarGAN, which is critical in a clinical setting. You want to be accurate and avoid dangerous errors.
And they could see this improvement visually in the confusion matrices, those charts that show where the model gets things right and wrong.
Yeah, the confusion matrix for the model trained with enhanced StarGAN data showed a clearer diagonal pattern, meaning more correct classifications across all the grades. It was especially better at correctly identifying the rarer, more severe grades, grades 5 and 6, where they started with less real data.
So it really helps shore up the model's performance, particularly for those critical high-severity cases.
That's impressive. What about judging the quality of the fake images themselves objectively? They use something called FID.
Ah, yes, the freshen inception distance, FID. It's a standard way to measure how similar the distribution of features in the generated images is to the distribution in the real images. The lower FID score means the generated images are statistically more similar to the real ones, basically. They look more realistic to another AI model, in this case, Inception v3.
And how did enhanced StarGAN score on FID?
It scored the best. Its average FID was around 30. The original StarGAN was up at 43, CycleGAN over 50, and CAT around 34. So enhanced StarGAN wasn't just better at the classification task, its generated images were objectively rated as higher quality and more realistic.
Lower is better for FID.
The lower is better, exactly. And this held true across the individual injury grades too, not just the average. It consistently produced images closer to reality according to this metric. Okay, so let's pull this together. We have this new enhanced StarGAN method. It tackles the problem of not having enough medical images. It creates realistic synthetic bronchoscopy images. And using that data significantly improves an AI's ability to grade inhalation injury severity based on a more objective outcome, ventilation time. What does this mean clinically?
Well, the potential is quite large. This points towards a future tool that could assist burn surgeons, providing a more objective, data-driven assessment of injury severity right alongside their own clinical judgment.
Helping standardize assessment and maybe leading to more tailored treatments.
That's the hope. More consistent, accurate grading could definitely inform treatment strategies and potentially improve patient outcomes down the line.
Where does the research go next?
The paper outlines a few clear paths. One is integrating even more data, multimodal data, so not just the images, but also clinical factors, lab results, patient demographics, painting a fuller picture.
Makes sense. What else?
Expanding the data set further, perhaps through collaborations to get more real images, or even exploring newer generative AI techniques beyond GANs, like diffusion models. And finally, using explainable AI.
Explainable AI. So
Yeah.
figuring out why the AI makes the prediction it does, opening the black box.
Exactly. Understanding the visual features the AI is focusing on is crucial for building trust and clinical adoption.
So we started with the limitations of the subjective AI score, and now we see this path forward using AI, specifically this enhanced StarGAN for data augmentation, coupled with a really solid clinical outcome metric ventilation duration. It really feels like that aha moment where advanced tech meets a real clinical need.
It really does. It shows how AI isn't just about finding patterns, but about finding patterns that correlate with meaningful, objective outcomes, overcoming the limitations of older methods.
And maybe a final thought for you listening, consider the broader implications here. We're talking about moving towards more objective, data-driven medical diagnosis using AI. How else could this kind of approach transform medicine? Personalizing treatments based on AI's deeper understanding of severity, not just in burns, but across many conditions. It certainly opens up some fascinating possibilities.
Absolutely. It makes you wonder what other subjective assessments in medicine might benefit from a similar AI-driven objective approach. Lots to think about.